After SIMB mode, we shift the patient to spontaneous mode to see if they can breathe on their own. Spontaneous mode is the last mode from which we want patient out from the ventilator. After SIMB mode, we put the patient in a spontaneous mode, and in a spontaneous mode all the breathing effort is by the patient. All the trigger from the patient. Ventilator just give the pressure support. There is not any pressure control in it. All the volume is inhaled is by the patient. Ventilator just support his breath providing pressure. So in a spontaneous mode, every breath is patient triggered. The ventilator only gives the pressure support, not pressure control. The tidal volume comes entirely from the patient's own effort, and the ventilator simply helps make his breath easier. This is the final step before weaning. Now let's talk about the liberation from the ventilator. So liberation from ventilator, weaning of a patient from ventilator. As we discussed, first usually patients are put on the CMB mode, then AC mode, then shifted to SIMB mode, then lastly into the spontaneous mode. Slowly and gradually we lift off the sedation and we try to put the patient in a spontaneous mode. We give a trial that whether the patient able to breathe or not. We do several ABGs regularly and check the pH is greater than 7.35, PCO2 less than 45 and PO2 60 to 80. That means that the ABGs are fine and we are ready to go, and the patient is doing well, that the patient can be taken off from the ventilator. You can also check the mental status, check the secretions, that whether the patient will be able to breathe if we take the patient out from the ventilator. So in summary, weaning follows a structured pathway, CMB to AC to SIMB and finally to spontaneous. For the spontaneous breathing trial, with sedations lifted, we confirm adequate respiratory drive and check ABGs, pH greater than 7.35, PSCO2 less than 45 and PO2 60 to 80 on low FiO2. If mental status, airway protection and secretions are acceptable, the patient is ready for extubation. And this brings us to the end of the mechanical ventilation series. Follow for more critical care content. Stay updated and thank you for watching.